Good evening, everyone, to another exciting episode of Heart Talks with Dr. Chinu. Today, as our guest, we have Dr. Jini Gopinath from Bangalore, who is not only a clinical psychologist, but also a clinical hypnotherapist. I happened to meet him many years ago when he was working with Christ University, Bangalore, and he was a convener of a great conference on hypnotherapy. And that was, in fact, my first brush with hypnotherapy. I have known Dr. Jini since then. He's not only a great psychologist, but an even better human being. So I'm welcoming Dr. Jini to this show.
Thank you. Thank you, Dr. Chinu.
Hello, Dr. Jini. How are you?
I'm good. Thank you.
So many of my audiences are very excited because they have heard a lot about you even before meeting you. And some of them are keenly waiting for this session. So let me start by asking you a very basic question that people ask me. Why do you call it hypnotherapy and not hypnosis? Is there a difference? And if there is a difference, what is it?
Thank you. Thank you for this invitation, first of all, and happy to be a part of this talk show. By the way, hypnosis, when we talk about hypnosis is an altered state of consciousness. So when I say altered state of consciousness, wakefulness is a state of consciousness, sleep is another, dream is another, and the fourth one is called trance. Is that what we call it as hypnosis? In Indian philosophy, it's called Turiya Avastha. So, and the application of hypnosis in a therapeutic setting is called hypnotherapy.
Okay. So when you use hypnosis in therapy, it is called as hypnotherapy. So there is no basic difference between hypnosis and hypnotherapy, right?
No, the fundamental process is going to be the same because we are using the altered state of consciousness as the tool here. But the application of hypnosis is limited to a therapeutic setting. Then it's called hypnotherapy. By the way, hypnosis is used in other domains also.
And that's why, Dr. Jini, many of the people, especially in our part of the country, are very scared when you tell them that, we are going to use hypnotherapy. So they will ask you, so you will hypnotize us? So then what if something wrong happens? How will we come to know? And, they become so guarded consciously that it is sometimes very difficult to use hypnotherapy.
Yes, I completely agree with you. That's primarily because the print media, the visual media, and now the social media, everywhere, it's been projected as something with a lot of this, mystery attached. So there's a lot of stigma attached with this. A lot of as a therapeutic model, as an independent scientific branch itself, there are a lot of stigma attached. That's primarily because the way in which it was being used from time immemorial. If you see the history of hypnosis, it was used as as a healing, alternate healing process in temple tradition. It was used in other cultural, and even today. Even today, it is used as an entertainment tool in some places, right?
Yeah, on stage shows and magic shows, you see. Yeah.
I think that could be the reason why people have difficulty in terms of connecting with it as a therapeutic model. But right now, that worldwide, there are a lot of studies going on in terms of projecting it as a scientific tool itself.
Yes, that was going to be my next question. And I remember that, in the conference that I was just referring to, I had written a paper on history of hypnosis, and I had raked up some evidences of how hypnosis has been a part of the Indian Ayurveda and all these things as well. Because at that point of time, I did not practice hypnotherapy because I was a person who was trained in REBT and CBT mainly. And so I myself as a counselor was very reluctant to use hypnotherapy. And I thought that, there is a great gap between the rational therapies and the dynamic therapies. So, Dr. Jini, can you clear this confusion that young counselors sometimes have, that a person who is using logical, evidence-based, rational therapies cannot use hypnotherapy, or it is against their ideology?
That's a very interesting question, by the way. Since you mentioned about rational therapeutic models, going back to rational emotive behavioral therapy, Albert Ellis used hypnosis extensively in his therapeutic work. So I was referring to an article which was shared by one of my very good friend. It was published in 1996, where he published an article on a case study of a case named Ellen. So I'm just giving an example. So it was not about rational emotive. I mean, people who are rational in nature cannot have or cannot use hypnosis as an independent therapeutic entity. But the rationale you give it and the kind of integrative models you come up, that also needs to be highlighted here. See, for example, there is a model called cognitive hypnotherapy by Dr. Hassan Aladdin. He was talking about integrative models. How can you integrate a cognitive work with cognitive behavioral therapy, which is very rational in nature, very empirical in nature, with
Yeah, and you are yourself trained from Beck Institute in CBT, like me.
yes,
And
yes.
and do you also use cognitive therapy with hypnotherapy?
Yeah. So I use this model called cognitive hypnotherapy by Hassan Aladdin, and Dr. Hassan Aladdin is from Calgary Medical University. So he was a former president of American Society of Clinical Hypnosis also. Where and we have another models like mindfulness oriented hypnotherapy by Michael Yapko. So we have analysis, combining hypnosis with
And with
psychoanalysis.
psychoanalysis.
Yeah. So it's not like hypnosis cannot be integrated, or people practicing cognitive behavioral or rational emotive behavioral models cannot gel with the rational of hypnotherapy. But the new model of integrative or integration helps us in terms of integrating these models together. So, and when you talk about the same empirical process, I would say that American Psychological Association, Section 30, now is Society for Psychological Hypnosis. There is a separate president for the society also now under APA.
Yes. Earlier it was Division 32 that hypnotherapy used to come in.
Now it's 30.
Yes. So, there is a lot of empirical evidence for the practice of hypnotherapy as a psychological intervention, and it is a scientific stream of psychotherapy. I would like to ask you, Dr. Jini, what are the cases in which we would prefer to apply hypnotherapy, or what are the kind of disorders or kind of situations where we should prefer it as a treatment of choice?
Okay. So just want to answer one more point from the previous question. I think most of the people look up to Harvard and Stanford as the prestigious institutes in the world. Stanford is the first university to start a hypnosis laboratory. Back in 1950s. It was started by Ernest Hilgard, one of the very famous psychologists. And he's a person who start with empirical studies in the field of hypnosis and came up with this Stanford suggestibility scale, analyzing the suggestibility index of an individual. Which and even today, one of his partner was from psychiatry. His name was Herbert Spiegel, and now in the Department of Psychiatry at Stanford, his son David Spiegel is working, where he's also promoting hypnosis. I just wanted to tell the audience that in Stanford, Harvard, these are all taught in the mainstream psychology subject. Even Sheffield University in UK, they had masters in hypnosis. Yes. Now coming back to your question, At this point in time, hypnosis is used extensively with emotional disorders,
Hmm.
uh, where mild to moderate depression and also anxiety spectrum disorders, except OCD. OCD also you could use it, but as an adjunct therapeutic model, not as an independent therapeutic model.
Hmm.
Uh, but by the way, when you come to other disorders like personal disorders, childhood disorders, eating disorders, other habit disorders, you can still
Hmm.
use it, but this is not the primary therapeutic
Treatment of
model.
choice. Hmm.
Yeah, and because of a couple of reasons. One primary reason is that hypnosis do not have a theory of personality.
Hmm.
So it should be used with another therapeutic model like CBT or REBT or psychoanalysis. So that
So,
it can be taken to the next level.
okay, so I have got two questions suddenly together in my mind. So I'll ask one by one. One is, as you say that it is an integrated model that it is most effective in. So, what is the use of hypnotherapy when we combine it with CBT? What is hypnotherapy contributing to the therapy?
So hypnotherapy, when do we use it? So when you ask the question in a different way, the primary rationale for using hypnotherapy. So say for example, first uh, pointer is it can accelerate the therapeutic process.
Hmm.
Say, for example, in conventional CBT, if you could take 12 to 16 sessions, if you are using hypnosis along with cognitive behavioral therapy, you could complete the therapeutic model in 12 or less than 12 sessions itself. So you can accelerate the therapeutic efficacy. That is a primary goal. Second one, when there is some kind of a unfinished business from the past, and if you want to revisit it, then if you want to get into an abreactive model, and if you think that that is one thing which is blocking the client to get into the next level of her life, and which is the primary trigger for relapse, then you might require a tool like hypnosis to revisit that and abreact that. So it's a combination model. When I say integration model, I was referring to technical eclecticism. You don't need to really believe in hypnosis. You don't need to really think that hypnosis needs to be the primary priority or primary modality. But you could still use some of the techniques from hypnosis, borrow some of the techniques from hypnosis, and use it as a part of your mainstream CBT or REBT or person centered or whatever model you are following. So these are the
I think
primary goals. Yeah,
Yeah, I think one of the reasons of using hypnotherapy with CBT might be accessing and dealing with the core beliefs, because the automatic thoughts and the intermediate beliefs can be logically discussed and deliberated with the client, but when it comes to core beliefs, there are some of them which are ingrained from the childhood, and those memories can be really painful for the client. And maybe when we come to that core belief kind of blockage, we can use hypnotherapy to ease it out.
exactly. Because it will be easy for us to dig deeper. But
Yeah.
when the client is in trance, it will be easy for him to look into the past and or into the deeper psyche.
Hmm.
Otherwise, you might require two couple of sessions to understand core belief. This here
Yes.
is a little more easier. Yeah.
Little easy. And what about PTSD? What is the role of using hypnotherapy in PTSD?
Hypnotherapy can also be used, but if you look at the primary therapeutic, the research data, it says that the when you compare with EMDR and when you compare with CBT, the hypnosis, the use of hypnosis is not very much indicated. You can still use it, but if you want to use it, you can use it as an integration model. You can use along with EMDR or CBT. But if you have to write it in the order of uh, efficacy studies, then I would like to go by EMDR first, then CBT, and then hypnosis and other therapeutic models.
Okay. So the other question that popped up in my mind simultaneously was that, I am more of a wellness therapist where I am working more with the non-clinical population and using psychoeducative models and teaching people how they can, equip themselves with coping strategies. How can hypnotherapy be of use in wellness?
That's another very interesting one. So, the use of hypnosis in psychiatry or in medical field is primarily is just one segment, one
Hmm.
specific area. But when you move out of that, its use is vast and varied. Say, for
Hmm.
example, in the wellness industry, starting with enhancing confidence and in coaching. Simple
Hmm.
example, the book written by you know Sir John Whitmore, Coaching for Excellence, where he has mentioned about hypnosis and the use of hypnosis in performance enhancement.
Hmm.
Even in wellness itself, the
Hmm.
recent debates with Dr. Deepak Chopra, he has
Hmm.
mentioned about the use of hypnosis in psychoneuroimmunology, how the immune systems can be enhanced by the psychological processes, where hypnosis can be used as one tool in accelerating that process. So it's starting with it, like you very clearly mentioned about enhancing the coping strategies,
Hmm.
healthy coping strategies, starting from
Hmm.
assertiveness to you know enhancing, improving confidence, self-esteem, efficacy, efficiency of an individual. You can use hypnosis in that way. By the way, the application of hypnosis not in the psychiatry alone. It can be used in gynecology now. It is used
Yes.
in obstetrics, something called
Oh, I
compassionate.
remember. I remember Dr. Alok Prapanna, demonstrating a case in that conference where they had done a surgery under hypnosis, and there was a dentist in that conference who
Yeah,
presented a case, and there is a big book on hypnosis in dentistry as well.
yeah, yeah. So the pointer which you made here was on hypnoanesthesia, where
Hmm.
chemical anesthesia is not required. You can use
Hmm.
hypnosis as an anesthetic tool,
Hmm.
which has been very popular now. And in
Hmm.
dentistry, hypnodontia,
Hmm.
this is being
Hmm.
used extensively now. So the application of hypnosis, unfortunately, we are limiting. I mean, the print media and the visual media is limiting only to psychiatry, but
Hmm.
or psychology, but that's only the
But it has
clinical
got
side.
wider potential.
Exactly. So it's huge. Dermatology, it is used extensively. So I
Yeah,
think
I
yeah,
have, yes, there is one Dr. Neerja. Are you aware about her? Who treats warts by hypnosis.
yeah, yeah.
And she has got so many cases presented in international conferences. And so, dermatology is another big area where hypnosis can be used and is being used.
Yeah.
And one more thing I remember from that, extensive course that we did in Christ University, Dr. Radha Mohan uh, took a session on self hypnosis and the benefits of self hypnosis, and she equated it to a 10-minute meditation. And she said that that everyday self hypnosis, if you can learn it, it can benefit your whole emotional and mental health system,
Yeah, yeah.
and it can.
So application of hypnosis, yeah,
So the parasympathetic nervous system gets activated, and the stress sympathetic nervous system becomes a little uh, subdued. So, Dr. Jeannie, the next question is, how did you get attracted to hypnotherapy? We would be very interested to know your own journey.
yeah. So I was from the degree days onwards, my graduate days onwards, we were very much fascinated by hypnosis because we had a teacher who used to demonstrate hypnosis in our classroom. But after that, we didn't get an opportunity like the way we have right now. Never had an
Hmm.
opportunity to take it forward to the next level, where to attend a workshop or a training program and things like that. So the first training program which I attended was after my during my MPhil studies at KMC Manipal, where
Okay.
Dr. Bhaskavyas from
Bhaskar Vyas. Huh?
from Baroda
Hmm.
did a demonstration in hypnosis, and later that was for a short, half an hour or 1 hour introductory lecture. So
Hmm.
after that, I traveled to Baroda and attended a couple of his workshops. So that was from Baroda. I started learning hypnosis in a structured way, and a lot of other people also helped me and supported me. One of my batchmate
Hmm.
from KMC Manipur, he was a psychiatrist, Dr. Nitin Shukla. He's
Hmm.
also a very famous hypnotherapist,
Hmm.
and he's a psychiatrist, and he's a practicing hypnotherapist.
Hmm.
And he also, encouraged. I attended his
Hmm.
couple of workshops in Delhi that time. Then International Society of Hypnosis is considered to be the world leaders in hypnotherapy and hypnosis training programs. So I traveled to Germany. This was in 2009 or 2010. Then that time
Hmm.
when I was at that time I was in Christ University.
Hmm.
So 2009 or 2010, I attended their programs in Germany, where they mentored some of us who are not was from these Asian countries where they don't have such structured training programs.
Hmm.
So they mentored us in terms of getting into the professional side of hypnosis.
Hmm. When you
And
mentioned about Germany, I recollect that gentleman who had come to that conference from Germany, and he was interested in shamanism. But
Andrea,
I,
Dr.
huh?
Andreas, Dr.
Dr.
Andreas.
Andrea, yes. I don't remember whatever he talked because he looked so handsome that there was no chance to listen to what he was talking.
Yeah, I agree, agree.
Anyway, so this is your journey in hypnotherapy, and how did you think of taking it up as a training model and practicing? Because I think that with a Baroda is a hub of hypnotherapy. You can always say that, and we are going to talk about the courses as well. But I think I can easily credit you of taking hypnotherapy to so many places across India, because you have been one of the forerunners to popularize hypnotherapy as a mainstream treatment in India, being a clinical psychologist.
Yeah, so after coming back from Germany, started the course in hypnosis in the Department of Psychology at Christ University. So we ran this course as a certificate course for a couple of
Yeah, I
years.
remember. Hmm.
Yeah, so 2000 till 2013, I used to run this course as a part of the PG program, postgraduate
Hmm.
program in the Department of Psychology. But in
Hmm.
2013, I moved out
Hmm.
of Christ University and started my full time clinical practice and established a training center in Bangalore
Hmm.
where we started conducting hypnosis diploma programs affiliated with ISH, International Society of Hypnosis.
Hmm.
So, and after that, we started training programs in different parts of the country,
Hmm.
associating with different
Hmm.
people. So there is
Hmm.
Dr. Prashanto in Calcutta, who used
Yeah,
to
I
give,
had him in one of the talk shows.
and he is now the head of the Department of Clinical Psychology
Yes.
at Institute of Psychiatry.
Yes.
So, in associating with him, and we also used to associate with a couple of other clinicians like Dr. Talochan and all from Chandigarh.
Hmm.
So this is how we started.
We also wanted to have one workshop and conference at Agra many years ago, but it didn't materialize. I was coordinating it. Anyway, so Dr. Jini, with this advancement in hypnotherapy in India and this kind of awareness that we have now, what do you think is the future of courses and training in hypnotherapy? Because I see that there are so many people who want to learn hypnotherapy, especially psychologists and counselors, but they end up in very dubious centers and with fancy names. So, how do we guide them? How do we tell them that these are the right courses and these are not?
Unfortunately, hypnosis training in India is still in infancy. So we have very few universities teaching it as a separate academic program. So it started with Baroda MS University, where Dr. Bhaskar Vyas started almost 20 years ago, where he took the training syllabus from London School of Economics, London School of Hypnosis, and started the program almost 20 years ago, which is running even today. It's a
Even today,
postgraduate
yes.
diploma in clinical hypnosis, but there's an evening program. So 1 year evening program. And there is another very famous clinician. He's also a medical professional, Dr. Palan,
Dr.
Bhupendra
Pal.
Palan. Dr. Palan has recently started, almost 3 years ago, started another course with Charusat University, again from Gujarat. So these are the two universities which is to train hypnosis from a university setting. The university degrees are from these two universities. Otherwise, there are a lot of other training programs conducted by people affiliated with ISCH. ISCH is Indian Society for Clinical and Experimental Hypnosis. You are also a part of that from
Yes.
Baroda, where otherwise there are no other universities teaching it. We also conduct different programs in Bangalore and different parts of the country. Uh, but the future, when you look at it from today, I would say that future is bright because a couple of universities are interested in starting hypnosis as at least as a credit course in their
Yeah.
psychology PG program. But we are also planning to start it as independent diploma programs affiliated to universities. The discussions are going on. Hopefully, things will materialize in the coming academic year.
Yeah. And we have Janki, Dr. Janki. She's saying that she's a proud student of Dr. Palan over here. And I have one question. In fact, two people are asking this question about the ethics of practicing hypnotherapy. What are the ethical considerations when we practice hypnotherapy?
So, by the way, the ethical standards which you follow with your clients in other therapeutic models, the same ethical standards are applicable in hypnosis also. So see for example, there is a misconception that in hypnosis you can manipulate the individual,
Others.
you can brainwash the other individual and things like that. But usually what happens in hypnotic setting, the client, when you talk about the consciousness, if you have to divide it into two components, one is alertness and awareness. The client may not be alert, but the client is aware. I mean to say that whatever if you think that you can abuse the client, or you can do something else, or you can say something else, what the moment you go outside the boundary, the client will be able to understand.
I have an experience to share to distinguish between alertness and awareness. So, what happened? Dr. Bhaskar Vyas was demonstrating this, hypnotherapy to the whole class, and he conducted a mass hypnosis session on the stage. And there were around 20 volunteers, and we were all lying on the stage, you know, lying flat in supine position. And he planned to put a needle in our skin. Now, the suggestion he gave was that your left hand is going numb and it is freezing and it has become cold. And I was very much in trance. I am a very suggestible person, hypnotically. And I was feeling that my hand has become like ice cold. Now they started applying spirit to put the needle.
Okay.
When they applied spirit, I, being a medical doctor, I could, recognize the smell. And I immediately opened my eyes and I woke up.
Okay.
And the whole show was spoiled because it was supposed to be a demonstration of mass hypnosis. And so, yeah, Dr. Bhaskar Vyas, he sat with me over there, holding my hand so that I don't get up and say that I'm not in trance. And he demonstrated it with other people. And then he talked to me after that and he explained this to me. What is alertness and what is awareness? So it is a dual state. It is not a singular state.
Yes, yes. And so the answering back to going back to same question. So the ethical standards are same for almost all therapeutic models. Here, it's stays the same. Yeah.
Yeah. Thank you so much. And Dr. Jini, there are many of our audiences who are very curious to see a demonstration. Can you put me in trance? Because you cannot obviously put them in trance.
Yeah, fine. Okay.
Or maybe you can demonstrate one of your favorite induction techniques.
Sure. So I'll do one thing. Since it has its own limitations in doing it
Yeah.
in an
Yeah.
online forum, but I can definitely demonstrate one induction technique.
Hmm.
So the induction technique which I am going to demonstrate now with you is
Hmm.
called eye fixation technique, which is a very
Okay.
standard
Hmm.
induction technique, and this is
Hmm.
also called braidism.
Hmm.
Why? Because
James
braidism.
Braid. Hmm.
Because it's developed by James Braid, the person who coined the term hypnosis,
Hmm. Hmm.
and and this, like any other induction models, this technique is a very classic one. It was developed somewhere in 19th century, but even today it is being used extensively. So you
Hmm.
can see
Hmm.
the success rate of this
Hmm.
particular model.
Hmm.
By the way, when you talk about an induction technique, it starts with a preparatory state, then there is a transition state, and there is a hypnosis rapo state.
Hmm.
Since we are not getting into a deep trance and all here, I will just demonstrate keeping the suggestions into the first two states.
Hmm.
Fine.
Yeah.
So you're ready now.
Yeah. Yeah.
So sit in a very comfortable position, whichever the comfortable posture in the sense whichever is it's a very subjective state.
Yeah.
Whichever is comfortable for you, you can adapt that. And this is
Yes.
going to be around 5 or 6 minutes maximum.
Hmm.
In that time, if you feel like changing the posture or coming out of this particular situation, you can do that. You're
Hmm.
absolutely free to do that.
Hmm.
Just close your eyes, focus on your breathing. We'll do a 1 minute breath watching exercise to settle you down. Collapse your entire body and slowly start focusing on your breathing, your normal, natural breathing, which is going on all by itself. Inhale and exhale. Just when you inhale, feel the cool air touching your nostrils. And when you exhale, feel the warm air touching your nostrils. Just feel it. You might get a lot of thoughts, a lot of images, a lot of impressions during this 5 minutes, 6 minutes session. That's absolutely normal. But the moment you realize that you're thinking something else, come back immediately to your breathing. Now, as you realize that your breath is becoming more deeper and rhythmic, you may slowly open your eyes and look up without lifting your head. Look up on the ceiling on an imaginary spot there and stare at it if possible. Without lifting your head, just stare at a point. As you keep on staring at it, you will be able to see that your eyes are becoming drowsier. Your eyelids are becoming heavier and heavier and heavier and heavier. Your eyes are becoming drowsier. Eyes are becoming drowsier. Eyelids are becoming heavier. Eyelids are becoming heavier. Eyelids are becoming heavier. Eyes are becoming drowsier, 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 and there is an irresistible urge inside that you need to close your eyes. There's an irresistible urge for that because your eyelids are becoming heavier, heavier, heavier. And close your eyes right now and relax your eyelids. Make it comfortable. Just relax your eyelids and make it comfortable right now. and continue focusing on your breathing and see how beautifully your eyelids are closed right now and how beautifully your body is relaxing. And your eyelids are kind of glued together. It's kind of glued together. Even if you want to open your eyes, you may not be able to open. It's kind of glued together. Kind of glued together. Now, if you can try opening your eyes, but you may not be able to open. Try, but you may not be able to open. Continue there for 30 seconds, just comfortably continue focusing on your breathing. Continue focusing on your breathing. Normal, natural breathing, which is going on all by itself. Normal, natural breathing. Very good. Now I'm going to count from 1 to 3. When I count 3, your eyes will be able to come back to the normal state of functioning and you'll be able to open your eyes, come back to this session absolutely wide awake. 1, slowly coming back. 2, getting ready. And 3, take your own time, slowly open your eyes and come out. 1, 2, and 3.
Yeah. So no, the virtual screen or anything is not a limitation at all. All I could feel was your voice, which was very clear in my ears, and I forgot that we are on a virtual medium.
So,
It was
this is an extensively used one because the failure rates are very low because what we did was ocular fatigue, inducing ocular
hmm,
fatigue, and that fatigue is being converted into a trance by giving suggestions.
hmm, hmm.
So, and being a
Yes.
suggestible client, and also the kind of we know each other, so there is no
Yeah, the
need
chemistry
for
that we share, that
yeah,
also helps
also can
because
do the
because of the factor of trust and faith that you have in each other. So this brings me to the next question, Dr. Jini. Can anyone learn hypnosis, or you yourself have to be? You need to have certain characteristics to be able to learn hypnotherapy.
that's again a very interesting question, and at the same time a very difficult question also. So when we ask this question, so Milton Erickson, Ernest Hilgard, they have very clearly given the answers, like saying that what are the characteristics of a good psychologist, or a good
Hmm,
counselor, or a good mental health professional, or a medical
hmm,
doctor in that way.
hmm, hmm,
Anybody who is working in the helping profession, they might require certain characteristics like non-judgmental, authentic, empathetic,
hmm,
able to communicate properly, a constant learner, and
hmm,
more important at this point in time, ethically sound.
hmm,
So these are some of the characteristics which are required, the baseline requirement for you to enter into hypnosis, so that we know that this person won't mess up the
hmm.
entire process.
Hmm.
Unfortunately, we don't have any specific tools and parameters to
To
understand
check.
the joining when a
Hmm,
person comes for learning hypnosis. But over a period of time in the process supervision, we'll be able to understand whether he is on the right track. And we screen
hmm,
out people when you
hmm,
when you take clients, I mean students, into the advanced modalities. We
hmm,
definitely screen them out in that
hmm,
way. Otherwise, also we'll be able to know that after a point they may not be able to practice this modality
hmm,
because it
hmm.
requires
Even
a
if
lot
they
of
learn. Hmm,
even if they're here, even if they're there. But otherwise, hypnosis, these are the basic characteristics required for an individual to take up. But you know that now that's not the case.
hmm,
This is used since it's used in the entertainment industry. A lot of people are getting into that. But unethical practices are more in that segment, not in the
hmm,
clinical setting. I mean, clinical and
hmm,
counseling settings, they're all already counselors, they're
hmm,
already clinicians. They
hmm.
already have that particular skill set
Mindset.
or
Hmm,
basic characteristics which are
hmm,
required to work with a client.
hmm.
So, yeah,
Okay. Another question we have is, does hypnotherapy help in grief counseling, which is the need of the hour?
yeah. So, hypnosis definitely helped. But I would say that when you look at an issue, a rational for using hypnosis, I would say that hypnosis need not be the primary model here.
Hmm.
Hypnosis definitely can be used, but there are other models which can be used extensively in these settings, especially in
Hmm.
normal grieving process or with pathological grieving process or with depression and all. Hypnosis can be used, but
Hmm.
not as a primary therapeutic modality.
Hmm. Yes. And how do you connect this to the third wave psychotherapy like ACT, DBT, and all these things? And especially mindfulness, which you mentioned as well.
Yeah. So hypnosis is used extensively with mindfulness now. So most of the third wave psychotherapeutic models like DBT and ACT also, they use mindfulness as one of their primary therapeutic
Yes.
process, right?
Yes.
So there is
Yes.
a beautiful model by Michael Yapko, who is the author of Trance Work and other textbooks which are very popular, bestsellers in hypnosis now. So he has merged hypnosis with mindfulness and came up with a very beautiful model. How can we use hypnosis in the third wave as a
Hmm.
part of mindfulness, not as an independent entity? Like I said, integrating this with hypnosis, and they found that it's extremely useful, especially if you're using it along with mindfulness in the context of DBT, especially in the borderline cases, and also in the context of ACT. You can use that.
I'm going to ask you one more question on this, but before that, I would like our audiences to know that we are going to have Dr. Mahendra Sharma sir, who is from NIMHANS Bangalore and the pioneer of mindfulness-based stress reduction treatment and training in India. And we'll have him on 7th of July on Heart Talks. And so we'll get a lot to learn and talk to him as well. And the question for you, Jeannie, is what is then the difference between mindfulness and hypnotherapy?
Yeah. So hypnosis, you will definitely get into the active induction is used to get into an altered state of consciousness,
Hmm. Hmm.
where uh, past is also involved, where you might have to move to the past, explore the
Hmm.
past, and sometimes you might have to visualize the future and those domains and things like that. But in mindfulness, it's a completely entirely different domain altogether, where they focus
Hmm.
on the present,
Hmm.
where the active processing of the past and the future is not expected in a mindfulness process. But this is and hypnosis is used only as a tool. Mindfulness as an independent modality itself, in terms of
Exactly.
bringing in therapeutic benefits. Yes.
Yes. And I also am very curious on the behalf of my audience to ask you about age regression in hypnotherapy.
Yeah. So age regression models, there are two types of models now. One is age regression, and the other one is past life regression, coming from the transpersonal side. So age regression model comes under hypnoanalysis, where so what happens is that the first person to start using this in a structured way was Sigmund Freud and Joseph Brewer. In the case of Anna O,
Now.
where they used it and they named it as abreaction model, abreaction process, where during that time itself and little before them, even Pierre Janet also used this in his therapeutic processes. So age regression is basically helping the client to go back to that time and age in which the entire dynamics happened, and resolving it then and there itself is kind of an abreactive model. So what happens when you have something happen in the past, it was too much traumatic for you. So what happened, they just cover it up and push it aside instead of addressing it properly. So hypnosis or hypnotic like modalities will help you in terms of going back to that particular situation, state of body and mind, open it up, address it, and close it properly. so that
Hmm.
that unfinished, the nature of that unfinished business is resolved completely. So this is
Hmm.
one of the primary rationale for using age regression.
And you know about my special interest in transactional analysis by Dr. Eric Byrne, and he also uses something called as life script. And there is a lot of age regression involved in life script, where lots of past memories come up and then they are addressed in the TA way. But in life script, one of the mainstays is also future progression. Is there anything like this in hypnotherapy as well?
Yeah, future progression is also there. Something called step up techniques. Say
Hmm.
a simple example is you've been worried about public speaking, and you had a
Hmm.
couple of experiences, bad experiences from the past. So this age regression is done in terms of resolving those conflicts. Now, future progression is done in terms of helping you to equip yourself to handle these situations in the future. So this is something called step up technique, which is used in CBT also, by the way. So hypnosis is used in age progression also, but there is no transpersonal side. Usually, when people talk about age regression and age progression, people see, I mean, connecting it with past life regression. So how do you know
Hmm.
that what's going to come up in the future? So we don't
Hmm.
know, but we are equipping the client,
Hmm.
helping the client to acquire those necessary skills so that they
Hmm.
will be able to handle those situations in the future in a more adaptive manner. So that is the agenda of age progression.
Yes, yes. So, one of the things that we do in recovery focused behavior therapy as well. Once you are recovered, then how will you behave? How will you speak?
Ah,
So, that is also, in imagination itself, we are doing it.
yes, yes, yes. Yeah,
Dr. Gini, it is said that, only humans have this capacity to imagine. It is a distinctly human resource that we have this capacity to imagine. And does it mean that animals cannot be hypnotized at all?
there are instances, there are situations reported where animals are hypnotized, but we don't have any conclusive data at this point in time to prove that that was real hypnosis.
Hmm.
But impact was felt in
Hmm.
different occasions where there are cases reported in our scriptures also, right? Where these saints were able to control the other, I mean, wild animals and things like that. And there are cases reported in the modern.
There is a famous, there are two things. One is that when Krishna used to play his flute, all the animals used to come and listen to his music. So, they used to get mesmerized by the music. And another person who was capable of doing it was Mia Tansen, who, when he played his music, all the animals used to run and sit quietly, even lions.
Yeah,
And I think these things cannot be proved, but uh,
yeah.
they're there.
There are a lot of claims. There are a lot of people claim that they are able to hypnotize or control. They use the word control here, but
Hmm.
we assume that this is what hypnosis is what they are mentioning. But the cross verification, when the team has gone to collect data to understand what they are doing, they were not able to get data to reliable, valid data to support their claims. Yeah,
I'm stopping myself from asking you questions on past life regression because we won't be able to do justice to that topic in this episode, and we need a separate episode for talking about it. But still, is there anything that you would like to talk about past life regression as a therapy? And is it also an evidence based therapy like hypnotherapy, or are we still not saying that there is a scientific claim to it?
so by the way, this is past life regression is not a new concept for India, because we have in yoga where there is a concept called pratiprasav, which is
Hmm.
similar to that of past life regression. But this
Hmm.
was popularized by Brian Weiss in his book Many Lives and Many Masters. So after that, this became a very popular subject. So
The
the
case of Catherine.
case of Catherine, and the way he healed that particular person, and he was not able to understand how this healing is really happening. And a person who was completely, um, no, I don't want to say that he was an atheist, but he never believed or he never listened to these claims of past life and reincarnation studies and all.
He himself was a psychiatrist. Is a
Yeah,
psychiatrist.
he's a psychiatrist, and so the kind of data he collected from Catherine during that one uh, particular course of therapeutic process, that was kind of um, shocking for him as a
Hmm.
psychiatrist, as a scientist, because his initial training was in psychopharmacology, so in the
Hmm.
chemistry and hardcore physics. So
Yes.
he was actually shocked by the data he got it, and after that he has conducted around more than 6,000, 7,000 sessions in this particular area, and he found that the entire philosophy of past life regression is helping the client. There is no data to support why the client is suffering. Age
Hmm.
regression failed because there is nothing in this particular time frame. So past life regression will help you in terms of going back to your previous birth and try to understand the kind of struggles you had there and let go of that. So from a karmic perspective, you are holding on to that. The sanchita karma, which you have collected over a period of time, is not helping you to go out of that. So letting go of this karmic cycle is a primary point. So to add to that, there are a lot of reincarnation studies as of now available. University of Virginia, former head of the Department of Psychiatry, Dr. Ian Stevenson. He was very much kind of stayed in India for a couple of years, conducted a lot of studies and all. So he uh, kind of proved reincarnation is possible. His two-volume book, Biology of Reincarnation, is kind of proof of that. Even today, society, I mean, the Department of Perceptual Studies in University of Virginia conducts a lot of research in this domain. And the former head of the Department of Neuroscience, Dr. Satwan Pasricha, she also conducted a lot of studies in that. So I just want to combine it together and say that I don't know whether we can prove past life is possible, but past life regression is getting a lot of results. Lot
At
of
least
results.
that is the way ahead. And I'm very curious about parapsychology, metapsychology, and the spiritual side of it and the philosophical side of it. But I keep myself guarded, being a rational emotive behavior therapist and a CBT therapist. I don't want to say to anyone that this is one part of thing that is recommended, but at least we can deliberate on it, we can discuss on it, because unless we do that, how do we come to conclusions? And there might be some really good promising potential scientific studies in the future which might give us some conclusive data as well. And so what is the harm in at least exploring these topics?
Yes, yes.
And of course, when we have this yoga and karmic cycles and these concepts traveling to the West from India, and where they are, very much attracted to these concepts, why not we as Indians try to do some evidence-based researches which are
So I strongly connect with you in that line where, I would say that we need to be more open and flexible in
hmm,
adapting these new information into our system also. If it's not reliable, if it is not valid, if it is not helping our clients, just eliminate
We
it
can
from the
discard
system.
it. Yeah. Yeah.
Yeah. But
Yeah.
unless and until you are open, you may not be able to receive this information. You may not be able to understand whether it's correct or not, right?
Exactly. Exactly. And who thought that, something like mindfulness will become an evidence based treatment? A few
Yes.
years ago, you would not have believed in it. And it is one person who thought that it has got potential, and he neutralized it. He, you know, released it from the religious flavor, and subjected it to scientific experimentation. And now we have an effective treatment in mindfulness.
Yes, yes, very true, very true.
So, thank you so much, Dr. Jini, for being with us. And it's been such a great conversation with you. Never felt like, it is almost 1 hour already over. And we discussed right and left and in depth in so many ways. And I hope to have you again in our next season with more interesting discussions on maybe uh, some more, mysteries to be unraveled.
Thank you for
Psychology.
this amazing opportunity. Always fascinated by the to see the way you work and spread these information to the public. It's really appreciated, and I could really connect with that philosophy of yours. Thank you for
Yes.
inviting me and giving this
Thank
opportunity.
you so much, Dr. Jeannie. And I think that as psychologists, we have a big responsibility to shoulder to psychoeducate the people and create awareness, because otherwise, things like hypnosis becomes so much mysterious and misunderstood by lay people unless we talk about it as intellectuals and people who have studied it. It will really not make sense to people.
Yes,
And that's
yes.
why a great opportunity to interact with you. And I think that we have not met in person for many many years, and I hope to meet you very soon in Bangalore.
Thank you.
Thank you so much. Thank you.
Thank you. Thank you. Thank you.